Dental sleep medicine pertains to treating the medical disease obstructive sleep apnea by a qualified dentist as outlined in the joint publication from the American Academy of Sleep Medicine and the American Academy of Dental Sleep Medicine in Darien, Illinois. Apnea, which is the Greek word for absence of respiration, is what occurs when there's an obstruction in the upper airway. The collapse of the upper airway causes a lack of airflow in the nose and mouth for 10 seconds or more. You'll also hear the word hypopnea, which is shallow breathing or severely decreased airflow, leading in a disruption of the patient's oxygen level in the blood. Obstructive sleep apnea is a medical condition diagnosed by a physician that can be treated in the dental office. The Food and Drug Administration categorized oral custom fabricated mandibular advancement appliances as a Class II medical device. It is available only by prescription from a medical doctor. This is proof the dentist is not treating outside their scope of licensure, and the medical doctor assumes the ultimate responsibility to oversee the patient's medical care. A dentist that treats snoring without a definitive diagnosis or ruled out diagnosis leaves themselves liable should anything happen to this patient, because they are treating a medical condition without either ruling out disease or diagnosis of a disease. Snoring is one of the 75 sleep disorders recognized as a medical disease. However, there's no medical insurance coverage available for the diagnosis of primary snoring. As a dentist can get started in dental sleep medicine to enhance the quality of life for their patients with obstructive sleep apnea with little to no equipment cost. Once they have learned the basics of the disease and understand the condition they are treating, there are several courses that will teach dentists the basics of dental sleep medicine with the intent of selling them expensive equipment and services. Other than clinical training and administrative staff training on dental sleep medicine, the only financial expense would be a gauge to measure the mandibular protrusion. Everything else, such as Panorex machine, basic instrument setups, impression trays, and material, is already in the office. All you need is the education.